Hi, everyone. It's Carrie and Rebecca. We're coming to you from our partner meeting, which we have every week. And Rebecca was telling me about a presentation that she did this morning for a group of folks that aren't necessarily super healthcare savvy. And she was talking about the concept of healthcare innovation. It made me realize that some people really don't have a good understanding of what healthcare innovation is. So we thought we'd talk with you a little bit about that today and give you our thoughts on what really defines healthcare innovation. Rebecca, you want to tell us a bit about what you spoke about?
Sure. Yeah, and I'm really glad we're having this conversation because we are a healthcare innovation law firm, and we don't often talk about exactly what that means, exactly what we see day to day. We've got hundreds of clients operating in this country and outside this country in the innovation space. And while that seems like sort of a niche population of clients, it's actually it's quite varied. So, and we do get questions from investors, from business people who come from tech, who are entering healthcare, for established companies who aren't familiar with the space, accelerators and things that are like, they want to know sort of what we're seeing. So this is a twofer. This is sort of how we think about healthcare innovation and also the kinds of healthcare innovation companies we're seeing in the market. So I'll start with companies that are actually changing care itself. These are companies who are changing the actual nature of healthcare. So these are companies like those developing diagnostic tools that didn't exist before to diagnose ailments. These are things like treating mental health illnesses or mental health disorders with virtual reality tools. Also, what we've seen for the last 10 years is a real shift from sort of, I walk into a hospital and the hospital takes care of me. I walk into my doctor's office, my doctor takes care of me, to payers and large health systems and even employers building sort of care coordination, like a wraparound of services, so that your healthcare and your nutrition and your social and behavioral needs, your housing, even in some cases, that's all sort of being taken care of, and it's part of healthcare.
Yeah, that makes sense. Healthcare delivery is really dramatically changing, especially since the pandemic, I think. We have seen telehealth and virtual care services and remote patient monitoring really be elevated and top of mind in the healthcare profession and in patients, right? There were a lot of patients who had never had a telehealth visit before the pandemic, and now many people have experienced a telehealth visit, providers and patients alike. And it's interesting because even though that technology has been around for a while, we're really kind of viewing it as healthcare innovation because prior to the pandemic, it was not widely adopted.
Yeah, and the other thing that we're seeing is large non-healthcare players enter the market. And of course, that's been happening for a while, but it's now sort of top of mind in the news. Amazon's a good example. And in fact, not only are they getting into virtual care, but they're getting into home-based care. So they're starting to see consumers have a desire to have all of their services, not just their packages, happen in their home. And so we're really seeing a shift in the private industry toward home health and house calls and home care, where you're not really seeing that from a sort of government payer side. The other thing that these big data companies are able to do is develop new tools to improve care outcomes, not just the care that they provide, but the care that other providers provide. So certainly, artificial intelligence and machine learning have been big buzzwords. We work with a number of predictive analytics companies that work with not just hospitals and health systems, but pharma companies to be able to do precision medicine, new medical devices, new pharmaceuticals. All of these tools are also a component of healthcare innovation.
Yeah, one thing I noticed recently was that Verizon, right, the cellular and Fios vendor, recently acquired BlueJeans, which is a Zoom-like sort of platform, right? It is designed with user friendliness in mind, and Verizon bought BlueJeans, the company, with the explicit purpose of making it available for telehealth visits, creating sort of a telehealth visit tool that Verizon could pitch to medical practices. And I think it is a good sign that companies like Verizon are looking to technologies like the BlueJeans technology, which are pretty well known for user friendliness and good interfaces, to push out for use by providers and by patients. So there's a lot of healthcare innovation going on around user experience, both for the providers who are providing the care and the patients who are receiving it.
Yeah, and speaking of big acquisitions, just today they announced that Microsoft had made a $19 billion acquisition of Nuance, which is a voice recognition company. And so another area of healthcare innovation is sort of how do we get the data into the places we need the data to be into to make good decisions about care. So we all know about the big health, electronic health records companies, the Cerners and the Epics, et cetera, the Athena Healths. But those companies are still, by and large, really disliked by a lot of the people who have to use them. And so Nuance not only has a massive user base, but it also has this voice recognition technology that could really relieve burden on physicians when it comes to entering information into EHRs as they move into the healthcare space. So again, these sort of big acquisitions by non-healthcare companies to get into the healthcare space are driving a lot of innovation.
Yeah, super interesting. Patient engagement is really sort of another aspect that we're seeing percolate up in healthcare innovation. I think there's a sort of renewed belief that patients who are engaged with their care are going to be better off and have better outcomes. So we're looking at patient engagement tools like remote patient monitoring, where patients are actively taking their physiologic readings, right, and having those reported to their care providers. Patients, can now be to a certain degree incentivized to adhere to a particular treatment plan, that type of thing. So around that newfound sort of renewed belief that patient engagement is important, I think we're seeing, some good stuff going on there. And then sort of the last thing that comes to mind for me is innovation among provider entities themselves. So, much more, many more interesting arrangements across the care spectrum. So, maybe a behavioral health therapy practice collaborating and affiliating with a series of medical practices that are, also collaborating with post-acute providers and are collaborating with the health system. These aren't all new. Accountable care organizations have been around since 2012 now, I guess. But we're seeing models that have showed some success being built upon, and new and innovative payment and delivery models evolving. Rebecca, any closing thoughts before we sign off for today?
No, I mean, I'm sure we've left some out, and if any of you are watching this, please feel free to add some. I know one of the things that has been really exciting recently has been the impact of all this innovation on the ability for folks to access care, access specialty care, and certainly remote technologies are driving that. But also, the federal government's driving toward expanded broadband use, which is really going to open up the industry even further. And the other thing I would just say is employers are really getting into this space, right? Self-insured employers are doing direct purchase of healthcare services outside of the insurance structure. And so a lot of the innovators that we're representing are not just selling to the payers, not just selling direct to consumers, they're selling direct to large employers who really are motivated to reduce their healthcare spend. So anyway, so this has been a fun discussion. We love all things healthcare innovation. Thanks for listening.
Thanks, everyone. Until next time.